Okay, so welcome, ladies and gentlemen. We are looking right now at a view of the anterior arm. And in this view, we have the humerus right here. We have the anterior scapula right here. Down here, we have the elbow joint, and we see the radius out on the lateral side, and we see the ulna on the medial side, okay? If this is the humerus and this is the scapula, then this right here is going to be our shoulder joint, okay? So this whole video is going to go through the bony landmarks of the scapula, humerus, and some landmarks near the elbow. And then once we go through the bony landmarks and muscle attachments, we're going to talk about the muscles themselves, and you're going to see how the muscles attach to each one of their attachments and how they layer upon each other, okay? And this whole video series is going to go through all of the compartments of the musculoskeletal system in the same exact way, okay? So if you want to learn the musculoskeletal system from front to back, this is the video series that you need to look at. You're going to learn all the bony attachments, all the bony landmarks, all the muscle attachments. You're going to see exactly how the muscles layer upon each other and how they relate to each other. And this is very important for identifying structures on a practical exam and also for understanding the function of the movements at each one of these individual joints. Okay, so without further ado, let's just jump into it. So this is the humerus right here, and this is the anterior view of the humerus, okay? One of the first things I want to point out is the joint that it forms with the scapula. So this right here is the humeral head, and it is a very soft, I shouldn't say soft, a smooth, rounded surface, okay? It's a ball that fits into the socket that is the glenoid fossa right here. Okay, so I'm going to type these things in for you as I name them. So this landmark right here is going to be the glenoid fossa. Okay, that is the glenoid fossa. All right, and that is the landmark on the scapula, which forms the articulation of the glenohumeral joint. Okay, so this over here, this is the humeral, sorry, let me put an H, humeral head. Okay, the smooth surface of the humerus that forms the glenohumeral joint, aka the shoulder joint, is the humeral head. Okay, now before we go into the rest of the humerus, let's talk about these landmarks that we have here on the scapula. Knowing the landmarks on the scapula is critical for learning all of the muscles that attach around the shoulder. Okay, so first things first, when we're looking at the scapula from this anterior view, we're going to see that there is a fossa right here that is facing directly towards us, okay? A fossa is any shallow depression on bone, okay? And this fossa is one out of 3 fossa that you're going to find on the scapula. This is the one that is on the anterior face. The other 2 that we're going to see in a separate video are on the posterior side of the scapula, okay? This one is called the subscapular fossa, okay? And there's going to be a muscle we're going to see later that's called the subscapularis, which sits in this fossa, okay? So this is the subscapular fossa. This right here is an angle that is formed by the scapula. There's also another angle that's formed down here, okay? This angle up here is on the superior end of the scapula. This angle is on the inferior end of the scapula. Therefore, we're going to call this one up here. Can you guess what it's going to be called? It's going to be called the superior angle. This is the superior angle of the scapula. Likewise, this is the inferior angle of the scapula, okay? All right, so we have 2 angles, one that's superior and one that's inferior. Likewise, we have 2 borders, okay? So there's going to be one border right here, and there's going to be another border over here, okay? Now, if this is the anterior view, and we have the humerus over here and the scapula over here, that means that this side is the lateral side, and this over here is the medial side, okay? If you don't understand the difference between medial, lateral, superior, inferior, I would ask you to go back to the basics, and I may make a separate video just on that. But I'm assuming that you know what these words mean. So this right here is a border that is on the medial aspect of the scapula. So therefore, we're going to call this the medial border. Boom. Okay. Likewise, this right here is a border on the lateral side. So we're going to call this the lateral border. All right. There you go. Okay, so we have a medial border here, lateral border over here on this side. All right, beautiful. Now, over here, there's another landmark. So it's not, we can kind of appreciate it here, and we can also appreciate it from the posterior side. But what you can see is that as you follow from the superior angle here and you go along the superior border of the scapula, there's a point right here where it forms a notch. Okay, there's a little notch, a little notch that's formed right here. This right here is known as the suprascapular notch. Okay, that's the suprascapular notch. All right, the suprascapular notch is going to provide passageway for a nerve and an artery that we're going to see later called the suprascapular nerve and the suprascapular artery. Okay, now, so those are all the most important landmarks for you to know on the scapula. Okay, now we're going to talk about landmarks on the humerus. So on the humerus, I'm pointing out this part of the humerus right here. So this whole thing is the shaft. Up here is the head. And we're going to see what these things are called later. But right now, I'm going to point this particular portion of the humerus is known as the surgical neck of the humerus. Okay, surgical neck of the humerus. Now, there are times when there are fractures that are made on the humerus. Okay, and if a person suffers an injury anywhere near this area, it will usually cause a fracture here. Okay, so this is surgical neck of the humerus. Is an important landmark to know. Now, let's look at the more distal end of the humerus, the part of the humerus that articulates with the radius and the ulna to form the elbow joint. Okay, so when we're looking at this over here, what we're going to see is that there's going to be a surface, an articulating surface on the humerus that fits with the articulating surface of the radius. Okay, so the names of those are, the one on the humerus is known as the capitulum. The capitulum is this guy. Okay, let me grab it and move it closer. So this is the capitulum. Okay, and it is articulating with the head of the radius, or we could just call it the radial head. Okay, the radial head. Okay, likewise, there's going to be this little fossa right here. It's a little depression that is directly superior to the capitulum, and this is known as the radial fossa. Okay, radial fossa. Why is it called a radial fossa when it's on the humerus? Well, you're going to see when I explain this side also. Okay, so this over here, we have this articulating surface of the humerus is known as the trochlea. Trochlea. Okay, and this part, so we're specifically pointing to this projection of bone on the ulna. This projection of bone is known as the coronoid process. Okay. Likewise, this depression up here is known as the coronoid fossa. Okay. So these fossae are named according to these points right here, the coronoid process versus the radial head. And the reason for that is because what does the elbow do? The elbow flexes and extends. When this elbow flexes, right? When this elbow flexes, that radial head is gonna move across the capitulum, and then this part of the radial head here is gonna fit right into that radial fossa. Okay, it's gonna fit right into that radial fossa. And likewise, this coronoid process over here is going to fit into the coronoid fossa of the humerus. Okay, and you can kind of test it out for yourself. If you go ahead and you flex your elbow all the way to its ultimate degree, what you'll find is that at a certain point, it stops itself, and it's not a soft stop; it's a hard stop. Okay, because what we have is we have bone contacting bone. So this coronoid process is going to fit into the coronoid fossa, and the radial head is going to fit into the radial fossa when you go to the ultimate degree of elbow flexion. Okay, and we're going to see what happens on the opposite side for elbow extension. Okay, so these are all the landmarks for the humerus and the scapula, and these are not muscle attachments. These are not muscle attachments. These are some landmarks that you should know, but here now, these are going to be the muscle attachments that we're going to talk about. Okay, so let's start off. This right here, this is a sharp beak that is projecting off of the scapula. Okay, this right here is known as the coracoid process. Okay, that's the coracoid process. The coracoid process is going to be attachment site for 3 muscles. We're going to see 3 separate muscles that attach to the coracoid process. Okay, they're going to be the pectoralis minor, the short head of the biceps brachii, and the coracobrachialis. Okay, and we're going to go and you're going to see each one of these muscles as they attach here. Okay, just bear with me. Now, what we see over here is we have 3 landmarks, 1, 2, 3. Okay, these are 3 very important landmarks. So this one right here is the one that's out most on the lateral side, and this one is more on the medial side. Okay, this one out here is known as the greater tubercle. Okay, this one right here is known as the lesser tubercle. All right, so we have a greater tubercle, and then we have a lesser tubercle of the humerus. And notice that in between these 2 tubercles, there is a groove that is formed. Okay, this groove is known as the intertubercular groove. So let me go ahead and type these out for you. So the one that is on the lateral side out here, what's going on? No, okay. The one that's on the lateral side out here, this is the greater tubercle. Okay, that's your greater tubercle. And the one that is on the more medial side, this is going to be your lesser tubercle. Lesser tubercle. Okay? Now, and what did I tell you about the thing in between them? I said this is the intertubercular groove. Okay? That's your intertubercular groove. All right. Now, there's another name for this intertubercular groove that you may see in some sources. The intertubercular groove may also be called, and I'm going to put in parentheses right above it, the bicipital groove. Okay, the bicipital groove. Now, what is the word bicipital? What is that reminiscent of? That's reminiscent of biceps, right? Biceps. So the bicipital is also called the bicipital groove because you're going to find the long head of the biceps, right? Because the bi means 2. So it has 2 bellies. It has a long head and a short head. The long head of the biceps is going to form a tendon that sits in this groove. It runs in this groove and then goes over. It travels superior to the shoulder joint to then attach to the scapula on a bony prominence of the scapula that's called the supraglenoid tubercle. In this image, we cannot see the supraglenoid tubercle because it is hidden behind this coracoid process. But we can see the infraglenoid tubercle. Infraglenoid tubercle, which is down here. All right. We can see the infraglenoid tubercle from this view. All right. So the long head of the bicep is going to travel through this bicipital groove and then attach to the supraglenoid tubercle, which is essentially in the same place as the infraglenoid tubercle is. It's just superior to the shoulder joint, right? So the infraglenoid tubercle is inferior to the shoulder joint, or inferior to the glenoid fossa, I should say, okay, of the scapula, and the supraglenoid tubercle is superior to the glenoid fossa, okay? The supraglenoid tubercle is going to serve as an attachment site for the long head of the biceps brachii, whereas the infraglenoid tubercle is going to serve as an attachment site for the long head of the triceps brachii, okay? All right, we got that. So, and now we have this right here. What is this? This is essentially just I shouldn't say just. It's the humeral shaft or the shaft of the humerus, right? Tomato, tomato, you could say it either way. It's the humeral shaft, and we are going to have some muscles that attach to the humeral shaft, okay? Then we're going to look more distally on the humerus, and what we're going to find over here is we're going to find two epicondyles. Epicondyles is a common name that you're going to see for long bones, such as the humerus and also on the femur. And so we're going to have an epicondyle on the medial side, and we're going to have an epicondyle on the lateral side. So this bony prominence right here and this bony prominence right here are the epicondyles of the humerus. So this one right here is going to be my medial epicondyle, and this one out here is going to be my lateral epicondyle. Okay, beautiful. All right, let me move this for you. All right, so lateral epicondyle and medial epicondyle right there. Okay, so then what is this thing over here? All right, so this is a ridge that is formed directly superior to the lateral epicondyle. So we're going to call that the lateral supraepicondylar ridge. Okay, the lateral supraepicondylar ridge. Right, that basically just means the ridge superior to the lateral epicondyle. Okay, and yes, there's going to be muscles that attach there. Each one of these points that I'm showing out to you now are specific muscle attachments for specific muscles that we're going to see. Okay, now over here we have a point that I already showed you before. This point I already showed you this point before. This is called the coronoid process. Okay, and then this right here, this is a rough patch of bone that is on the proximal aspect of the ulna. Okay, this is going to be called your ulnar tuberosity. Ulnar tuberosity. Anytime you see the word tuberosity, that is telling you that you're dealing with a rough patch of bone. And I guarantee that there will be a muscle attaching there. If that's the ulnar tuberosity on the ulna, we also have a radial tuberosity. Radial tuberosity on the radius. We have a radial tuberosity on the radius. Okay, so that's your radial tuberosity right there. Okay, beautiful. So these are all the muscle attachments that we're going to see for the muscles in the anterior compartment of the arm. Okay, and now we're going to go through these muscles, and we're going to start from the deepest layer and work our way superficially. Okay, so first muscle we're going to deal with is brachialis. Okay, the two attachment sites for the brachialis are going to be the anterior humeral shaft and the ulnar tuberosity. Okay, so the brachialis is going to attach like so. Okay, so it's attaching to the anterior humeral shaft, and then it's going to cross anterior to the elbow joint to then attach, to insert itself onto the ulnar tuberosity. Okay, because of this course that it has anterior to the elbow, that means that when this muscle contracts, right, it's going to pull this ulna this way. It's going to pull the ulna up towards the humerus. It's going to cause flexion of the elbow. Okay, so your brachialis, what does it do? It causes flexion of the elbow, and that's it. That's all it does. Okay, beautiful. Next one. So we have the brachialis there. So I have the brachialis over here faded, so we can realize that it's still there. Next layer we're going to talk about is the coracobrachialis. Now, the coracobrachialis isn't necessarily superficial to the brachialis. It is in a completely different region. It's up here. It's superior, okay? And it's not going from humerus to ulna, all right? So it's not crossing the elbow joint. Instead, it's going from the scapula to the humerus. So it's crossing the shoulder joint, okay? And it's attaching to the coracoid process. Remember, I told you there are three muscles that are attaching to the coracoid process: the coracobrachialis, the pectoralis minor, and the short head of the biceps brachii. So this is one of them. It's attaching from the coracoid process to the medial aspect of the shaft of the humerus, okay? Right here on the medial aspect of the shaft of the humerus, okay? So what is that going to look like? It's going to look like that, okay? From coracoid process to the medial shaft of the humerus. What is this muscle going to do? It is Not in a great position to have so much leverage. It can contribute to a little bit of shoulder flexion and also can contribute to some shoulder adduction. But mostly, we call this a shunt muscle. And what that is, it's a muscle that basically keeps the humeral head fixed into the glenoid fossa whenever there's a major load that the upper extremity is carrying. So the example that I'll give you is, let's say you're carrying a briefcase with like 20 pounds of bricks inside, right? It's a heavy load that your arm is carrying and you're carrying it by your side. When you're carrying that, the force of the briefcase is going to be pulling your shoulder, is going to be pulling this whole arm down, right? And it's going to be attempting to essentially dislocate the shoulder. It's going to be pulling the humeral head out of the socket. So you're going to have muscles that cross like this, such as the coracobrachialis, the deltoid, the long head of the triceps, that they have this course where they run from the humerus up to the scapula, and they're going to serve as shunt muscles that basically resist any kind of force that's trying to pull the humerus down and out of its socket. Okay? That's what the coracobrachialis does. Beautiful. Next muscle, biceps brachii. Biceps brachii, everybody knows the biceps brachii, right? So biceps brachii has two heads to it, okay? The two heads both attach distally to the same place. So they're both going to attach here, okay, to the radial tuberosity. Remember how brachialis was attaching to the ulnar tuberosity? The biceps brachii is going to attach to the radial tuberosity, okay? And then from there, as you run superiorly, each one of the heads is then going to go in its own direction to attach to its own independent landmark. The short head of biceps brachii is going to attach to the coracoid process, whereas the long head is going to do what I told you before. It's going to go through the bicipital groove between the greater and lesser tubercles, through the bicipital groove, travel superior to the shoulder joint, and then attach to the supraglenoid tubercle, which in this view is obfuscated from us. It's behind that coracoid process, okay? But it's essentially the flip side of where the infraglenoid tubercle is down here. So what is that going to look like? That's going to look like this. Okay, that's going to look like that. So you can see that we started from brachialis, coracobrachialis, and then biceps brachii being the most superficial one. Now, a quick thing that I want to talk about function in terms of the biceps brachii is that the biceps brachii is attaching to the radial tuberosity, not the ulnar tuberosity. Okay, not the ulnar tuberosity. What does this mean? This means that the biceps brachii is able to produce flexion at the elbow same way as the brachialis does. Same way as the brachialis does, because it crosses anterior to the elbow joint. But, however, in addition to elbow flexion, the biceps brachii can also supinate the forearm. It can also supinate the forearm. Okay? And why? Because it attaches to the radius. And whenever your forearm supinates and pronates, that is not your whole entire forearm. That is not both the ulna and the radius moving. The ulna is always fixed in place. When you supinate and pronate your forearm, it's the radius that is rotating. The ulna is not rotating. The radius rotates. Okay? And so if you want to cause any kind of supination or pronation movement of the forearm, you must attach to the radius to be able to pull it into rotation either one way, out this way would be supination, or pull it back in this way, which would be pronation. All right. So the biceps brachii does two things. It supinates the forearm and it also flexes the forearm at the elbow. Okay. And obviously we can see that it crosses the shoulder joint. So it does have some function as a shoulder joint in terms of producing a little bit of shoulder flexion and also acting as a shunt muscle along with the coracobrachialis, especially the short head of the biceps brachii, which is this guy right here. All right. But overall, everybody knows that the major function of the biceps brachii is to flex the elbow, particularly when the forearm is in a supinated position. The brachialis will flex the elbow no matter what. It doesn't need the forearm to be in a supinated position for it to cause flexion of the elbow. Okay? Makes sense? If it doesn't make sense, message me and I'll explain it more. Okay. So this is the lateral head. This is the medial head. And that's all she wrote. That's the anterior arm. Those are all the muscle attachments, and those are all the bony landmarks and all the muscles that you need to know for the anterior arm. Okay? And next, we're going to move to the posterior arm. Gross anatomy is one of the most difficult subjects in the world. Luckily, it doesn't have to be. Anatomy is one of those subjects that needs constant verbal and visual repetition in order to get good at. What better way to reinforce this information than with the scientifically validated method of drawing? Neuroscience has shown us that we retain information better when we physically draw it out. That is why the Gross Anatomy Study Strategy Workbook is designed to walk you through all the layers of the musculoskeletal system, allowing you to draw the muscles into place. This is excellent for reinforcing muscle attachments, bony landmarks, muscle names, and actions. This will save you tons of time from mind-numbing tactics such as repetitive flashcards or passively listening to boring lectures. With this strategy, you can actually begin to enjoy studying again and have a much better way to retrieve the information. Order a copy of the Gross Anatomy Study Strategy today at the link below so you can spend less time being stressed and more time being blessed.